Sanjay here won't have speakers, which means he will have to project with his natural voice of the whole room. If you're quiet, that's going to be a lot easier for him, and I'm quite sure, because you tend to be very respectful folks, that you will attend that request. I don't know how to finish that sentence. So I'm going to give a very brief introduction. Sanjay here founded the Pandemic Prevention Network. He also founded a number of other initiatives, including SoGive, which is a charity analysis organization, and TIO, a mental health chat robot. Sanjay is also a financial consultant focusing on environmental, social, and governance considerations. He has written about pandemic risk for financial publications and has spoken about pandemic risk at conferences organized by the Institute and Faculty of Actuaries. And with that, I give the stage to you.
Great. Wonderful. Thank you ever so much. Real pleasure to see you all here today for this talk, which is given the perhaps somewhat buoyant, I think, title of, maybe playful title of You Too Can Save the World from Biorisks. So let's explore that. This is a talk driven by our work at the Pandemic Prevention Network. And in this talk, I'm going to start by giving a bit of background about the Pandemic Prevention Network, and also a bit of intro on pandemics and pandemic risks, not assuming any too much knowledge. And then we'll talk about why PPN. So I'm going to apply the ITN framework, which may be familiar to many people in the audience. If not, you're about to see it applied in practice, to help justify why I thought it was a good idea to found this organization and why other people have got involved. We're then going to talk a little bit about some specific policy asks. So this is to bring to life, as a result of our work at PPN, what are the things that might change, that we might help change to make the world better? And then I'm going to finish with what can you do to help? Spoiler alert, the answer will be get involved with the Pandemic Prevention Network. Okay, and what you'll find from this is, as the title indicates, the idea here is you do not have to be a biological expert to get involved. Anyone can get involved and have their part to play in keeping the world safer from biological risks. So just a bit of background about us, the Pandemic Prevention Network. So the Pandemic Prevention Network sits between, on the one hand, we have biological experts. So these are people at organizations that we've got to know, like the Cambridge Centre for the Study of Existential Risk and the Nuclear Threat Initiative and so on, doing really great work thinking about biological risks and pandemic risks and what needs to be done to keep us safe from them. And then on the other hand, we have decision makers, so policy makers, government officials. And our role is to amplify the voice of those experts with our community of grassroots citizens. So now, and I also should have said, my name is Sanjay, and if you want to grab me at the end or later on, do feel free to do so. So that was a bit about PPN. I'm just going to talk now about pandemics, and I'm going to go through this material quite quickly. So this is going to be very condensed, and try to leave a bit of time at the end for questions. So pandemics could be naturally occurring or engineered. And when I say engineered, I mean literally, somebody like a biologist has gone into a lab and engineered the pathogen. So let's think about naturally occurring pandemics now. Where do they come from? That could be deforestation, which messes with ecosystems. There's an interesting question, if you want to ask it at the end, about bats. Why are bats so important? I'm going to skate past that unless someone asks the question. Farming. How does farming lead to pandemics? Partly because of animals being very close to each other, which means that pathogens can move from one to the other. There's also antibiotic usage. This can be totally fine and safe, but it can also lead to AMR, which is antimicrobial resistance. And that also makes us potentially unsafe. And pandemics are not necessarily zoonotic. They don't necessarily come from animals. They could have come from an existing human pathogen. Now let's move on to engineered pathogens. So those could be deliberately or non-deliberately released. So if we're looking at the deliberate usage of pathogens, then one of the questions that it might be useful to explore, but I'm going to do a very succinct version of the talk, so I'm not going to explore it unless you ask the question at the end, which you're welcome to do. So state military usage, is that happening? Are there states which are doing research on biological weapons despite the fact that it's contrary to international law? Spoiler, again, the answer is yes. And so I could go into more detail about what's going on there and why that's happening. How likely is it that we could have some kind of bioterrorism or non-state actors? And that's quite a dynamic and interesting question. And then one of the risk factors, again, is an area which is sometimes referred to as dual-use research, an example of which is gain-of-function research. And this type of research has certain risks, exacerbated by issues around lab security. I'll touch on those a little bit later in the talk. Okay, so now let's get you involved. If you are on YouTube at home watching the recording of this later, you can get involved as well with this straw poll that we're going to do right now. So the question that I'm going to ask you is basically, what is scarier, a pandemic from an engineered pathogen or a pandemic from a naturally occurring pathogen? And for those, I mean, basically, just go with your gut feel. But if you really want to have details, some of them are put on the screen there. So let's define a serious pandemic to be essentially what some, like Andrew Snyder-Beta, might call a GCBR, a global catastrophic biological risk, one that it kills a substantial, maybe 10%, substantial proportion of the population. And let's look at a time horizon that's, over the next several decades or maybe the next 100 years. So you're only going to get two options, engineered or natural. You will not get a don't know options. You're just going to have to guess. Okay, so natural, just give you a moment to think about it. Natural, this includes the Black Death, the Plague of Justinian, the Spanish flu. Okay, who thinks that the naturally occurring ones are the scarier ones? Okay, and who thinks the engineered ones are the scarier ones? Okay, all right. So I don't know about you guys watching the recording at home on YouTube, but in this room we had more hands going up for the engineered. That would also have been my answer. I mean, it says in there in bold letters, engineered are more scary. It's up to you to choose how scared you feel by each of them. But I would like to add that there are caveats on the numbers in this chart that's taken from Toby Ord's book, The Precipice, which I heartily recommend if you've not read it. While there are caveats on the specific numbers on this chart, the story here I would stand by, which is that certainly for this sort of serious, very, very bad pandemic, worse than COVID level of pandemic, the engineered pandemics do, in my view, pose a greater risk, especially over a several decade time horizon. Why is that? So engineered pathogens can be scarier. If we think about how a pathogen comes about in the natural world, that pathogen probably wants to be transmissible, a measure of which is R0. But if it kills people a lot, it's not so good at being transmissible, because you want your host to do things like turn up at parties or conferences and cough on people and sneeze at them and all that kind of stuff. People don't do that so much when they're dead. So there tends to be this trade-off. However, if you can engineer the pathogen, well, then you might be able to achieve something that's both highly transmissible and highly fatal. And that's the scary thing. So I just want to highlight here that chart that you saw earlier where it had a very, very low bar for the natural pandemics. It was not zero, and I do not want to suggest that naturally occurring pandemics are not scary. They are scary, and that our view at PPN as well is that we want to prevent and help the world cope with both of those categories, even though we are more concerned about the engineered pathogens. Okay, so that was just a very quick bit of background about pandemics and pandemic risk. I'm going to talk now about PPN, the Pandemic Prevention Network. And just to recap then, what do we do at PPN? Our role is, we've got, on the one hand, bio-experts doing great work, thinking about GCBRs, global catastrophic biological risks, and thinking about what needs to happen in the world to keep us all safe from them. And our role is that we are grassroots citizens who also care about this. And so we act, you can imagine a model a little bit like Amnesty International or CND, where there are chapters, people who come together, learn more about the issue, and then take action, perhaps by writing to their MP or their politician that represents them. So, why do we think this is good? Well, first of all, there's a question of importance. How big a deal is it if we can contribute in our own small way to stopping a pandemic, particularly a very serious pandemic? There's multiple dimensions to this question. I'm just going to focus specifically on the risk that a pandemic may lead to human extinction. Does that sound like a bad thing? I think the answer is yes, but there are a couple of concepts here which I'm not going to go through in great detail because of time constraints. But if you're not familiar with them already, I would urge you, look them up afterwards, maybe find somebody else at the conference. If you're watching this on YouTube at home, phone a friend, chat to them about these ideas. You'll probably get a very interesting discussion. The upshot is potentially the benefits of avoiding human extinction now could be much, much, much bigger than they at first appear. And they already appear pretty good. So that's talking about extinction risk in general, or existential risk in general. Why biological risks? So this chart, again, taken from Toby Ord's book. And again, I'd say there are caveats on the numbers. But there's an interesting story to tell here on the right-hand side. And again, it looks like those are zero, but they're not zero. The things like climate change and nuclear, we have inanimate particles. So a greenhouse gas particle, a carbon dioxide particle, doesn't have any agency. It's not trying to do anything. Whereas we get more and more agency as we go further to the left. And therefore, we find ourselves getting more and more scared. And so, arguably, AI and pandemic risk are the top two, although, of course, there's more than one lens through which we can look at these issues. So that suggests that preventing human extinction, or indeed other bad pandemics, would be a really good thing to do, which I think is intuitive. Is it tractable? Is it doable? And one of the really interesting things is that we have a warning shot now. COVID means that, unlike a few years ago, if I go up to somebody and say, pandemics could be a really big deal and could be really bad for humanity, I no longer feel like a weirdo. I feel like I'm now just saying common sense. And is it neglected? So there's often a trade-off, and we've done lots of thinking about lots of different interventions before landing on this one. And there's often a trade-off between tractability and neglectedness. So if something is more tractable, it might mean, therefore, that it's already crowded, and therefore it's not neglected. Now, we did some surveys back in 2020 saying, because of COVID, do we think that we actually basically don't need the PPN anymore? We don't need all these people trying to push for change because politicians now know that pandemics are a big issue. However, we got responses then that indicated that we should be pessimistic about that risk. The World Bank uses the term going from panic to neglect when it comes to pandemics. And we've also seen since then evidence that that prediction was justified, and that there's been a big gap between some of the really good ambitions that we've seen, particularly in US policy, around what could be done around pandemics and what's actually happened. There's been signs of pandemic fatigue. Oh God, I've already spent so many billions on this pandemic stuff. You want even more money? God, what are you asking for? So all of this means that we need a stronger voice for the importance of pandemics. We need more people going to their representatives saying, this is my COVID story, and this is why I want you to make sure we get metagenomics or pathogen-blind diagnostics or whatever it is, whichever policy ask is going to keep us safe from the next scary pandemic. So that's a quick canter through. It doesn't cover all of the considerations. And now I'm just going to spend a bit of time looking at the policy asks. So what are the changes that we might help bring about in the world through our work? So this is not meant to be comprehensive, and it's not necessarily the case that we will work on all of these things. This is just giving you a flavor. So I'm going to start with the prevention bit on the left-hand side, and lab security. So there's an academic called Philippa Lentzos at KCL who's done some really interesting work in this area. There is an argument that many make that says that for the labs that contain the most dangerous pathogens, BSL-4 labs, they are nowhere near secure enough given how scary these things could be. And there's plenty of examples in the past, leaks of foot and mouth disease and arguably a Russian flu outbreak in the 1970s. Several other examples which are thought to be lab leaks, and some indeed believe that COVID is on that list as well. So improvements in security is on the list of things that are potentially interesting. Dual use research, lots more work is needed to enable that to happen safely and to regulate that in the right way and so on. On the natural side, we have common cause with many other people who are interested in climate change or animal welfare. Response, so health systems. With health systems, we're thinking about things like, what about having adequate stockpiling of PPE, personal protective equipment? What about having good supply chains to make sure that they can get to where they need to get to, especially when they need to be cold stored all the way through? Training for staff, making sure there's an adequate wargaming. So there's quite a lot of things that go into having health systems that work effectively here. And also, there's lots of interesting things about research that can be done on improved responses. So if we look at what happened going back to the start of the COVID pandemic, what were the tools in our toolkit that we could use to respond to it? We had washing our hands with soap and water. We had social distancing, quarantines. These are things that would not have seemed out of place in the 19th century. So what do we have that's going to be effective and can be easily and quickly deployable? And there's a lot of work needed around that, and a huge amount of investment is needed. So that's all really interesting stuff as well. And then I'm going to mention at the bottom here, international cooperation is really important. I'm just going to check how I'm doing for time. There is a thing called the BWC, which is the Biological Weapons Convention, and what that does is it puts together an international framework that communicates that biological weapons are illegal. Now, this thing, the BWC, is terribly funded. It's like, a few $1 million less than the amount of funding that a typical McDonald's restaurant can have. And there's a really interesting bit of background about how you compare the BWC and the chemical weapons equivalent, which was put together a little bit later in different circumstances. So there's really interesting work to be done there. There's a new pandemics treaty that could replace it or go alongside it. All of these things together and others collectively could really help to keep the world materially safer from biological risks. And we all could have a part to play in that. So you too could be one of the people that says, I'm learning about this stuff and I'm getting involved with this community. And when we get somebody coming to us and saying, hey, you know, one of our bio experts is going to have a meeting with this minister, you could be, oh, well, if I'm in their constituency, I'll go and write them a letter. You could be one of those people. You could be one of the volunteers that helps us to build that community. And also, what I'd really like to ask you to do right now, if you can, is to visit this website. And the reason why I'd like that to happen is partly because we've got a very, very, very nice volunteer who worked very hard to create a nice new website. And I think it would just be nice for her if there were lots of hits on the website with people having a look at it. It's a new website, so so do feel free to look at it right now if you're willing. She's not in the room right now, but she'll be watching the recording later. She'll be looking at the website statistics, and the SEO on it is not very good because it's a new website. So you'll have to type the URL into the URL bar. If you just go to pandemicpreventionnetwork.org, then it'll take you there and you can navigate to take action. Okay, I think we're getting to the time to wrap up. So do we have time for questions? Great.
Thank you very much. A round of applause if you want to. Thanks a lot. To start the questions, I will just start with a question that I have had. Just a moment ago, you said that the Biological Weapons Convention is an institute that's supposed to be like making sure no one does it. How come they're so massively underfunded if there's actually a lot of funding at least going to, say, open philanthropy? Is it like, is it forbidden
Great question. Yeah.
that like private actors fund it?
There's a few dimensions to this. Sorry, thank you. There is a few dimensions to this. One of them is about the history. So the Biological Weapons Convention was put together in the 1970s in the midst of the Cold War. So the way it was constructed was very different from the Chemical Weapons Convention, which was put together in the 90s. So the structures around the Chemical Weapons Convention are very different. They enable stronger teeth. They enable better funding mechanisms. And it means that the Chemical Weapons Convention, which is funded to the tune of $80 million per annum, which is like 20x or something more funding than the Biological Weapons Convention, totally different, much more effective. So this is a good thing in many ways. I don't want to have mustard gas in my lungs, so that I'm glad on many levels that we've got a good, strong Chemical Weapons Convention, but biological weapons are potentially much scarier. Do we have other questions?
I'm sure we have other questions.
Okay.
I will pass the microphone around just to make sure that you are going to be heard on the recording. So I'll just start with you.
What would you say we have learned from the pandemic so far? Because you just said some minutes ago that what we had in the beginning was washing our hands and social distancing. And I feel like 2 years apart, that's pretty much still it, but wearing masks and have a vaccine. And I think having a vaccine, that was pretty obvious that we would try to get. And so what would you say have we learned from the pandemic for maybe the next upcoming pandemic?
Great question, thank you very much. So there's probably quite a few learnings on one level, but the learnings that we have are on things like the importance of PPE stockpiling, the fact that we've got many nations now that have been through a pandemic of the severity of COVID means that there are institutional learnings in health systems. And if we in fact look at how COVID has played out in different nations, what we find is those countries that have had, for example, SARS #1, have got better responses. So there is some levels of learning that have happened. However, the structural sort of research learnings that I was alluding to, there's still a lot of work to do. If we want to get to a stage where, for example, we've got fundamentally different PPE approaches, like higher quality masks, or, for example, if your question alluded to vaccines and vaccine development. Now, at the moment, pre-COVID, developing a vaccine could take 10 years, easily. And the fact that we were able to get one in under a year, absolutely phenomenal. It was a testimony to the fact that there was so much hard work happening to make that vaccine happen. But despite that, it was still too long. It was still so many months where we were not able to get out and live our lives. So if we can develop platform technologies that enable that vaccine development timescale to go under, some people talk about 100 days, but even better, even quicker than that, that would be a massive development that would hugely, hugely help things. But we're not there yet. There's so much more that needs to be done to get us there. Should we do it by getting them to say it out loud and we repeat the question? Is that quicker?
We can do that. We have time, I think, for one more question. After that, there's a fireside chat with Will. So a bunch of you might want to leave the room. For the rest of you who don't want to attend the next session, you could stay here and have more of a discussion because I think there's nothing happening in this room afterwards. All right, so one more question.
So that...
You choose.
Yeah. Go on.
Given that it's very hard to engineer viruses and biological weapons like anthrax have been around for a very long time, and I think that 50 kilograms of anthrax spores are sufficient to kill about 1 million people if you drop them above the city. And I asked my microbiology professor, and he said that his lab would take about 2 weeks to develop this amount of spores. How come that no terrorist organization has done that before, given that how easy and how low the bar is?
Yeah. Okay, that's a very interesting question. So the question is, given how easy it is to develop certain types of biological weapon, why is it that no terrorist organization has done this before? So there's a few factors at play there. Some of it is that there are certain processes around getting access to the relevant materials that are still a bit awkward. Now, if your terrorist organization has people who are in a biology department in a university, then those become a whole lot easier. Also, as time goes on and as things develop, it's becoming increasingly easy, even if you don't have that advantage. I think historically there have been certain things that have just made it logistically harder. And one of the worrying things is that those logistical difficulties are falling away over time. Why are they falling away over time? Partly because of biotech development. Partly because of things that are actually really quite good. Like, it's great that we've got biotech development. Those biotech developments can help us develop new medicines and new drugs and all sorts of great stuff. But they also carry risks with them as well. And one of the things that really needs to happen, and that we as a community need to communicate to policymakers that we want this to happen, is that we have to, globally, humanity has to grasp those risks to keep us safe.
Thank you very much.
Thanks.
Question, Professor Newton.